All right, good morning, everybody, and welcome to our webinar on enhanced medical management services. We're very excited today to feature a number of great women, nurses, and clinical backgrounds who are going to talk about what Health Easy really does with utilization review, case management, all those things that are part of your plans, but maybe you don't know what that really means. So hopefully we'll bring you some good information about what those services really do for members, as well as helping the plan. I think most of you know who Health Easy is, but just in case we have some new guests today, we are an independent health plan founded in 1982, and we're located in beautiful Bloomington, Minnesota, where we're actually having summer. We are in day 8 of 90 degrees and almost 100, so very unusual. But that's our office here in the summer when it's not snowing. We administer partially self-funded plans for employers throughout the U.S., so we're known for our level of customization, innovation, and really a high level of concierge customer service. And certainly medical management is part of that concierge service that's so important. And so with that, I am going to turn this over to Tammy Bergwald, who is our Director of Clinical Care.
Thank you, Jeannie. Thank you, Jeannie. I am excited to be here and part of this webinar as we take a deep dive into our care management. Today, we'll be talking through how our medical management program works here at Health Easy. You'll get to hear the process of utilization review and case management, what it really is and why it's so important, and how Health Easy's approach really separates from your traditional care management that you may see within another carrier. With us today on our panel, we have two very knowledgeable and key players within our medical management team. Dr. Conley, our Chief Medical Officer, who works directly on staff here at Health Easy. Not only does she oversee our medical management program, but she's also a board-certified family physician at Catalyst Clinic here in the Twin Cities. We also have with us one of our own nurse case managers, Danielle Martinez, program called Boost Your Baby. And lastly, joining us today, we have Cindy Holm, who has over 30 years of experience in the healthcare industry, who will talk us through what she sees on a national level with respect to utilization review and case management. So before we jump into explaining this process, I really wanted to provide a high-level overview of what services we offer here at Health Easy through our medical management program. So our team is just truly here to help with all stages of life, whether you have a chronic illness requiring extensive treatment, you may need surgical intervention, or you're having a baby. We are all here to help our members navigate through their healthcare journey and making sure all of their healthcare needs are being met by our team by providing the very best healthcare possible. So our team consists of those highly trained nurses, your board-certified physicians, registered dietitians, coaches, and associates who all specialize in the areas of oncology, transplant, high-risk maternity, mental health, pediatrics, and pain management, along with our wellness, diabetic, and maternity programs, which we'll touch more on in just a moment. So all of these programs, too, are completely customizable to meet all of our clients' needs. So utilization review is truly where most case management cases are started, such as when you go to your provider and he orders a procedure or treatment that requires Precert, our team will receive the request and start the process of review immediately. Here at Health Easy, we have a pre-certification list that is determined based on CPT and HCPCS codes, whether a certain test or procedure is needing a review. So this list of codes is reviewed by our team continuously to provide better service for all of our members. For instance, most recently, we made the change to remove most all MRIs and CT scans from requiring full review before provider has approval, as we have found this really helps not only with members but providers perform these necessary tests more quickly. By not delaying any treatment, waiting for prior authorization, rather, we give approval up front and require necessary information to be sent in by the provider. This change has really helped with efficiency and better care and outcome for all of our members tremendously. I would like to now hand it over to Cindy to walk you through what a utilization review process looks like in further detail and what guidelines she sees being used to determine medical necessity when a request is first received. She'll also talk about the importance of URAC accreditation regarding this process.
Thank you very much, Tammy. I'm very happy to be here. Hello, everybody. I really wanted to touch upon with you all about the pre-cert process utilization review program. It really does start with your ID card and your plan document, because that's where you have the information documenting what the pre-cert requirements are. You know, although typically 95% of the time, a lot of times it's the provider's office calling to start to initiate the pre-cert. Pre-certification requests can come from anybody. That means the member, the patient, the broker, the employer. We will start and initiate a pre-cert with anybody that calls us on the phone. Then it's our job to reach out to the provider to obtain the appropriate clinical information, so that we can use that information that the treating provider is going to give us and bump that up against what we call Milliman care guidelines. So those are the guidelines that we use in order to review cases. The goal of pre-certification is threefold, all right? So we're looking at making sure that it is the right care / the right treatment at the right time and in the right location, inpatient, outpatient, surgical center, etc. It's also the very first indication or indicator of if a case should be referred over to case management. And that is something that is within our system and identified by the many different codes that are in our system, diagnosis codes, CPT codes, and the like. They will automatically be referred to case management to be reviewed to see if in fact it's a case that should be open. When cases don't meet those, we call them Milliman Care Guidelines, MCG, that our nurses are using, that's when we will escalate the case up to Dr. Connolly. And, you know, I want to make sure that everybody understands our goal here at HealthEZ is not to perform non-certifications, right? So the goal really of this program, as I said, is to look at the location of care. Is it the right care? Is it medically necessary? But more importantly than non-certifications, we're really looking at quality of care and making sure that that proposed treatment does meet best practices. That's all I had to say in a quick nutshell for pre-certification, Tammy.
Thank you, Cindy. As you can see, there are so many different steps and factors that truly go into this process of pre-certification. Dr. Conley, could you please explain what you're looking for when completing a medical review and your process as a provider?
Yes. My job when I'm looking through a review is to, again, kind of like what Cynthia was talking about, it's to make sure that what we are, make sure that what is being proposed as a treatment is the best option for that patient, the least invasive option for that patient. And what is it medically necessary? So what I start with is, what is the proposed treatment? What is the diagnosis and the goal that we are trying to reach? And what other options might there be that may be less invasive or safer or less risky to offer to the patient before that? There are also different there's MCG guidelines, but there's also what's best practice in a clinical setting. And so I have my own clinical practice, so I'm very aware of the guidelines and what is done in a real world setting, and can use that knowledge to help guide care as well. And then finally, there are occasions when a medication or a treatment or an intervention has not necessarily been FDA approved, but it is the standard of care to use that intervention. So oftentimes those reviews will come to me, and I will look into the necessity of the treatment, the safety of the treatment, and if that non-FDA approved treatment suggestion is appropriate for a particular patient, and would it be safe. And that's a lot of what I look into when I'm doing my reviews.
Come into play and how to. Thank you, Dr. Conley. So you may be wondering now, when does case management come into play and how do we determine if someone should be in case management? So we really want everyone to know that our medical management services and team are truly here for all members no matter what your healthcare need is, short or long term. We are here to ensure that every member has available resources they need and that these resources are being used in a timely and cost-effective manner to obtain optimum value for both the member and the group. Our case management team is truly known for our concierge services we provide to all of our members. But before explaining our approach and process of how a case is started for a member here at Health EZ, we'll have Cindy explain how she sees case management handled with other carriers throughout the U.S., and then turn it over to our nurse case manager, Danielle, to share our process and how we are different here at Health EZ.
Okay, so thank you, Tammy. I think what might be important too is to talk a little bit about URAC. So because Health EZ's programs, utilization management and case management, are URAC accredited, I want the audience to know how important it is to know that you are working with a URAC accredited program. Some of you may have heard about URAC, some of you may not. So I'll be quick on this, but I think it's just a good review. URAC is really the gold standard. If you think about the gold housekeeping seal of approval, that's what URAC is for medical management programs. URAC has been around for a long time, since 1990. They're a nonprofit organization based out of Washington, D.C. And what it does, it makes sure and looks at companies like us at Health EZ that we're really promoting quality of care. We are looking at efficiency and accountability, but also looking at clinical and operational standards. So having a URAC accredited program, I think, is very important to know, especially for any type of brokers and consultants. To know that is very important. These are national accredited standards recognized for benchmarking and best practices, and really important for any type of medical management organization like Health EZ to have. I will tell you that the accreditation process is grueling. It's very expensive. It is time consuming, and it's not even a one and done. Once you're approved, and usually there for about 3 years, the whole process starts continuously over and over again because there's so many updates. So when URAC is accrediting an organization such as us, there is a desktop review, there is an on-site meeting review. It is a very arduous process, to say in the least, but it's something that we feel like it's important. We have to submit annual measures and consistently demonstrate the quality. We have to make sure that we have policies and procedures in place because those are the things that they're looking for. And it's really all about core standards and accountability. And they're updated, they say every 3 years, but I will tell you that the updates to some of the core standards happen throughout the year and are something that we are constantly looking at and feel that's very important to have that URAC accreditation, whereas Health EZ's utilization management and case management is URAC accredited. So I just wanted to touch upon that, Tammy. Thank you.
Thanks, Cindy. As Tammy mentioned earlier, we are truly known for our concierge services. Not only do we help find the right providers, coordinate second opinions, but we also reach out and directly make appointments when needed. We act as a one main resource that all members and their families can utilize to help navigate through the healthcare system, especially at a time they need it the most. Our focus is to make sure our members are receiving the very best healthcare possible. For instance, during the pandemic, our team was dedicated to reaching out and touching every member who was currently undergoing treatment to make sure they were still able to access care during the shutdown. Everything from cancer treatments, maternity appointments, infusion services to therapy. We wanted to make sure we placed alternative care plans if needed. We moved infusions to home if deemed appropriate, helped find virtual therapists, and much more. One of our most memorable instances I like to mention is helping a maternity member who just moved to Chicago and was ready to deliver her second child. She didn't feel comfortable delivering alone without her family by her side, so we helped coordinate an at-home birth to allow her and her significant other to experience the birth of their child together. This demonstrates the flexibility of services we offer with being able to put together alternative care plans. Also, as Tammy mentioned earlier, in services available, we have a 24-hour helpline for all of our members as well. No matter what time of day it is, our members can reach our care team. Recently, we had a family who was in Costa Rica on vacation when a member became critically ill and needed to get back to the United States as quickly as possible. They called the helpline, and our team was able to arrange an air ambulance to get this member back safely to get the care needed. We were there for them throughout the 48 hours it took to make these arrangements. These concierge services you will find is the big difference between us and other large carriers. A couple of other programs I like to highlight is our diabetes and maternity programs. We offer free testing supplies along with coaching to our diabetic members. This not only helps with compliance but also helps lower A1C, and we even have success stories of members no longer requiring insulin. Our maternity program is called Boost Your Baby, where we have real moms under the guidance of our trained nurses reaching out and engaging members to help navigate through their pregnancy and offer support from the time of pregnancy up to 6 months following delivery. This program not only helps identify potential high-risk moms, but also gives our members a one-point contact during the course of their pregnancy. We provide updated education and resources along with breast pumps to all members participating. During COVID, this program was a great resource for new parents who needed help finding providers for their new babies to keep up to date on immunizations or just needing that extra support person to be able to reach out to during the shutdown.
Thank you, Danielle. Do you mind sharing how you really engage with the members and what you do when someone does not want to participate in case management?
Yeah, of course. So although case management services are often best served by direct communication between the case manager and member, there are occasions where a member does not wish to engage in these services. In these situations, Health Easy continues to be dedicated to delivering the same services as if the member were actively engaged. A case is still open and continued close monitoring of complex health or medical conditions, including medical necessity reviews, potential high dollar alerts, savings, and collaboration with medical providers involved. Our goal is to make sure that each member still knows if they ever need assistance, we are here to help. They are always provided our contact information. I find that the first contact you make with the member is one of the most important. As soon as that member understands we are here to be their advocate, they will allow the care to be provided and will have that trust built, which results in great participation in the program.
I think that was super well said, Danielle, and I agree. The first engagement with a member is the most important. Just truly knowing you have that one person you can turn to with any healthcare need that you have. This is what I love about our team here at Health Easy and what we do on a day-to-day basis. Dr. Conley or Cindy, do you have anything to add to case management on either what you see or how you would handle anything differently?
Our case management program, I definitely have some involvement in that. And one of the biggest things that I appreciate as a provider is the diabetic care that is offered. Having a point person that someone trusts when they're trying to deal with diabetes and navigate how to eat, how to test your blood sugar, how to do all that. If they don't have a solid relationship with a provider, I have definitely seen that patients feel very grateful to a case management team that helps them with that. So I think that's from a practice perspective, one of the most helpful things that Health Easy offers is to keep those patients with diabetes on track and really help them to get their numbers under control and potentially even, like they said, get off of insulin and get away from all that. So it's wonderful.
Yeah, I absolutely agree. And I think our team here at Health Easy, just with all our concierge services that we provide and just knowing that all of our members have that one main resource they can reach out to at any time is just absolutely fantastic. And that's
So I think I'm back on. I hope everyone can hear me okay. I'm not sure. Tammy, do you want to put me back on? I just wanted to say a few more things about case management. There we are. Thank you. Sorry about that. I didn't mean to cause the confusion. What I wanted to just have a few comments about as we were talking about utilization management and case management. At the beginning, I was talking about the pre-certification process and what we do there, but it also is really the first point, as Tammy said as well, of identifying cases for potential case management. It's important for you all to know that we have over 3,000 triggers hard-coded in our medical management system that automatically identifies cases that should be looked at for further ongoing case management. Something I do want to touch about is the national case management. I've been around for over 34 years. I'm also a nurse. I've done case management. I've done utilization review. What's different with Health Easy from the typical carriers, and I'll call them the BUCAs. BUCAs are the Blues, United, Cignas, and Aetnas of the world. We all know from experience that most carrier type of case management is not nearly as comprehensive as what you will get from Health Easy. Most of the BUCAs are looking maybe at large claim dollars over when a case hits over 100,000. They approve mostly everything. It's definitely not as comprehensive. I'll just leave it at that. With Health Easy, when a case is identified for case management, it goes through a very thorough screening process. We don't want to just open cases to open cases, right? We just don't want to open them just to do billing. We want to open cases because we know that we can have an impact. We can have an impact on quality of care. We can have an impact on that patient's life. Yes, savings is important. But case management is much more broad than just savings. With Health Easy's case management, it's important to know that people are staying alive longer. Technology, drugs, keeping people alive a lot longer these days. And with that comes more disease processes. So with our case management program, and my background is pediatric and neonatal ICU. And, I am not as familiar at all with adult, say, cardiac. With Health Easy's case management, you get specialist nurses working on your cases. So, as an example, we have specialty case management for oncology, specialty case management for transplants, with contracted centers of excellence for those transplants all over the country. End-stage renal disease, chronic kidney disease is a big ticket item. So within our specialty chronic kidney disease, where we have nurses working on those cases and providing education and support to those patients that may not even be on dialysis yet, but maybe are heading towards it. But with our chronic kidney disease program, we can help stall that process of going on to full dialysis, whether it be peritoneal or hemodialysis. They're both very expensive. But we educate employees and oftentimes can delay that patient having to go full on dialysis. Another thing that I wanted to make mention of is, we all know about this pandemic, and we all know with this pandemic has come a lot of mental health anxiety, depression, and addiction. So within Health Easy's case management program, we have a specialty program specific for these things that I'm mentioning, whether it be addiction, mental health, um, end-stage renal disease, transplants, and cancers. There's also premature babies and pain management we see a lot of. So those are the types of specialty type cases that are handled at Health Easy by nurses that have that type of clinical background. And I think that that's really important for you to know because, you know, as a case manager myself many years ago, case managers have to walk the walk and talk the talk when we're speaking to providers and negotiating. Case management can be identified through claims data mining, which we do as well. Uh, we do collect RX and we do, which is pharmacy, and we do look at past medical claims for any type of potential case management. But by and large, most case management is identified by the pre-certification process. And I think my last thought on case management, which I think is really important, is that there are so many companies out there that if a case management process and a patient or member refuses or just doesn't want to participate in case management, that's okay. A lot of companies will just close the case. We don't do that here. What we do is we totally respect and understand the privacy of that patient, of that member, but we will still continue to do case management services with the provider. There's oftentimes at hospitals case management nurses, coordinators at the facility level, doctor's offices. So we're going to respect and not bother the patient or the member, but we will still keep that case open because there's a lot of coordination and a lot of negotiations that we can do to help that case and save the plan dollars. And that really speaks to how your stop loss is looking at cases. So they like that we keep those cases open. Stop loss, obviously, you all know, is a very pivotal, important part of being self-funded. So that was my only commentary on case management, Tammy. I didn't mean to be so long-winded, but I'm very passionate about it.
No, I think that that's great. No, I think that that's great, Cindy. Thank you so much. And thank you, Dr. Conley and Danielle, too. I think that our discussion today has been really, full of information, and I hope that you have all found it helpful as well. Honestly, truly, healthcare is a maze, and we're so happy to be here and to be able to provide this level of service to all of our members and clients. So at this time, I'd just like to take the last few minutes that we have and ask our doctor, Dr. Conley, to talk about what we can do to really get our health back on track, following the pandemic. Now that things are starting to open up and thinking about our health, Dr. Conley, where should one really start, say, if they haven't had a routine visit since the pandemic, or say their children are behind in their well child checks or immunizations? Oh, Dr. Conley, I think you're muted.
Okay. One of the biggest things that I saw during the pandemic in regards to missing appointments was kids getting their well child checks. Not necessarily the ones, when kids are 3, 4, 5 that are a little bit less important, though still important, but those 2, 4, 6, 9-month appointments that are really important in the first year of life. Those are when kids are getting their vaccinations, getting their childhood immunizations, and if those appointments are missed, oftentimes we will see a delay in getting vaccinated. So if you or you have a child or a grandchild who's in that scenario, I just recommend getting them in and having a good conversation with their doctor if vaccinations were missed, on how to get back on track, how to get caught up, and how to make sure we get those visits taken care of and that nothing fell through the gaps. And then for people as well, a lot of people, particularly people over the age of 65 who were really doing a great job staying at home during the pandemic, missed those annual visits. So they missed those times when you would have a conversation about cancer screenings that need to be happening. How are things going at home? How's your memory? How are mom and dad doing? And so making sure that you just get in with your primary care provider, bring your parents in, bring your kids in, but just get back on track and start with your primary care doctor to see what you need to be doing for that.
Yeah, that's great. Thanks, Dr. Conley. And to our Boost Your Baby program, that really helps out with keeping those kiddos' immunizations up to date too, as we do follow moms through 6 months after post-pregnancy too as well. So that is something that we do here at Health Easy as well. And then finally, I wanted to touch on such an important concern right now in regards to mental health. I know that we've just seen, a lot come through case review, increase over the past year, especially in teens, and with substance abuse arises, like Cindy had mentioned earlier as well, really just across the whole U.S. With the isolation over in the last year and overall stress from the pandemic, Dr. Conley, can you give your professional advice on what to be aware of regarding your mental health and how to recognize or get help for someone else that may be in need?
Absolutely, yeah. I'm going to start by just kind of talking about keeping in touch with your own mental health. If you are starting to feel personally sad, low, needing more sleep than normal, not enjoying things that you normally enjoy, you don't get the boost that you normally would get from doing something you like going for a walk or getting coffee with a friend or something like that, and you're starting to notice that those things just aren't bringing you the pleasure that they used to. If you're having a hard time getting to work, staying on track, you might be having some issues with mental health or depression. And I would say absolutely go talk to your doctor, talk to a counselor, talk to a therapist to try to get back on track. In regards to keeping an eye on other people, one of the biggest things that we see with depression is people starting to kind of withdraw from relationships with others. So, and this is particularly true in teens. They'll start, if their moods are going low, if they're starting to get depressed, they'll start to withdraw. They won't be as engaged with the family. They won't be as engaged with school. You might start to see grades going down, assignments not being turned in, tardiness in terms of showing up, or even just not showing up to school at all. So those are things to look for in teens. In family and friends, you want to make sure you're watching, is someone seeming like they're sleeping way more, their energy levels really, really low, they're eating way less, or they're eating way more, they have big changes in their appetite. Those are all things to kind of look for, and maybe have a conversation with that family or friend, just saying, hey, is everything going okay? And encouraging them to reach out to a professional if they're having a hard time.
Great. Thank you, Dr. Conley.
Okay, that was fabulous information. We do have a few questions that have come in from the audience. And the first one is for Cindy. And the question is, how can an employer get better stop-loss rates as a result of having these programs?
That is a great question that we get all the time. So, when you're looking at stop loss, and we know there are several managing MGUs, let's call them, stop loss carriers out there that groups are looking to quote their business with, or brokers are looking to quote to get the best rates, right? So what stop loss is really looking for is the management of the plan and saving money, of course, right? So there are things such as telehealth, certainly utilization review, and certainly case management. But there's also, I think as Tammy mentioned or Danielle mentioned, the disease management program. Managing those high cost type of cases, whether it be end stage renal disease, chronic kidney disease, especially the cancers. And the stop loss organizations that you're working with need to know that working with Health EZ, you have these specialty programs available. You have the transplant specialists. You have the oncologists. We have a full board of panel of physicians per specialty that can help. Stop loss companies want to look for savings. They want to see that the plan is well managed and managing, especially, as I mentioned earlier, a lot of those high cost types of diagnoses. Within the type of reports, and we're an open book here at Health EZ, we're very transparent. We do predict out for the next 12 months out, whether it be RX or whether it be medical, what the potential costs are for those individuals that have a high cost diagnosis, or it could be even a surgical procedure. They want to know what's coming down the pike. We're very transparent with them. Our case management reports do include what we're doing, the treatment plan, ROI, and the type of savings. So if you're looking to get and we, I think that we have very strong relationships with our stop loss companies that our groups are using, and that they know that they can call us. They know that we can provide reports on savings at the drop of a hat. And they want to know that we are managing the plan and that we are saving money wherever we can.
Great. Thank you, Cindy. We have another question here. And it's, I think, for Dr. Conley. So now that provider offices are open, what do you think the effect of telemedicine will be going forward? And do you think that virtual care is effective?
Great question. I think that one of the best things the pandemic has done is to show that we can provide good quality care with telemedicine for particular diagnoses. Mental health, for example, is a part of medicine that has really flourished with telemedicine. I mean, access to counselors, access to therapists with the use of telemedicine has really broadened what we can provide to patients. There are quite a few physical diagnoses as well that can be managed via telemedicine, from insomnia to anxiety, depression, medication management, ADHD, and stuff like that. Something that doesn't require blood work or any physical exam is a great example for how to use telemedicine. And I think it offers patients a way to get care easier. A lot of our patients have a hard time taking the time off or getting the sitter that they need to come into the office in person. And so for them, telemedicine is a great option. So I do think it will stay around for a long time. The issue is going to be making sure that it's used appropriately. There are diagnoses where it's not appropriate to try to manage high blood pressure without having the patient in your office to check their blood pressure, to do a physical exam, to check some blood work. So it's just going to be kind of trying to find that balance of how to optimize using telemedicine for the right things, and how to make sure we get people in the office for those things where they need to be physically here.
Thank you. And I think, Cindy, you had mentioned something about telemedicine in your closing comments. Did you want to add to that?
Yeah, I would, because I want the audience to know that with Health EZ, and we've talked a lot about behavioral health, and certainly we have seen it with the pandemic. But with Health EZ, you do have the option to select a program that we offer, which is a combined medical telehealth program as well as a behavioral health. And the behavioral health is a 24/7 program that members can access 24/7, where they will be triaged by a master's level clinician. Following that triage, and because of the pandemic, it has been virtual, but the program with Health EZ, it can include up to 5 visits, face-to-face or virtual. So we've seen, I think, all of us at Health EZ have seen the need for more telehealth, and I think, unfortunately, the pandemic has definitely helped push some of that. So with Health Easy, I just wanted to mention you can get a medical telehealth, and as Dr. Conley was saying, it's not for everything, and it certainly doesn't replace your PCP, right? But it's there for things that you can combine it also with a mental health 24/7 line as well.
Great, thank you. One quick question, which I will answer. Yes, there will be a recording available following the webinar. So if you did miss part of the webinar, we'd be happy to send that to you. Thank you. And I think the next question, this might be a little bit tricky one, but this is for Dr. Conley too. So what is your opinion on pregnant women getting the COVID vaccine?
Yeah, Jeannie, thank you. That is a tough question. There's at the end of the day, I'm going to just start by saying, it really should be a conversation between the patient and their OBGYN, their OBGYN provider, to determine the risk and benefit of the vaccine for each individual patient. There's some patients who are very high risk if they were to get COVID. And they might choose to take the vaccine. And there are some who are lower risk, and with the, lack of clinical data that we have surrounding the vaccine, they may choose not to. So what I'm gonna say is I would have every pregnant patient have a one-on-one conversation with their OBGYN to make a decision that's best for them.
Great. Sounds like good advice there. We have one last question, and then we're right up against the end. And that might be for either Tammy, Danielle, anyone actually. So from an employer, when employees come to them and they're frustrated because they are waiting for pre-certification on a procedure, can you talk about, what the timeline is and why it might not happen instantaneously?
Yeah, so
I'm happy.
go
I'm
ahead.
happy to comment. That's a very valid question. It's a good question. We get that all the time, and we know that there's frustrations when employees are knocking on HR's door, perhaps, and saying, I need this done. I need this pre-authorized, and I haven't had it done yet. It's not been completed yet. Why? So I think what's really important is the education that has to happen to the employees, to let them know it's not a 5-minute moment. To get a pre-certification is not a 5-minute moment. It can be if we get the clinical information in time. So when you think about the initiation of a pre-cert, like I said earlier, it can come from anybody. But it's our jobs at Health Easy in our pre-certification department. We have to reach out to the treating provider to get additional clinical information. Because remember, what I said earlier is that we're using the Milliman Care Guidelines, and we need pertinent and thorough clinical information. So what happens is it's telephone tag, unfortunately. We take it upon ourselves to make sure that we're calling that provider, leaving messages. Oftentimes we don't get through on the first time, so we have to leave messages and the provider has to call us back. I think, sometimes that's what happens when pre-certifications get delayed, is it's that telephone tag and waiting for the provider to call us. Providers are very busy. They're seeing patients. We get that. Sometimes we do ask when we're having a really hard time that the patient just leave a message with the office and say, could you please call? I need to get this pre-certified. I know my surgery might be scheduled for, 2 days out or 3 days out. Sometimes we have had to ask patients to push along the provider to let them know it's important, because we do make calls every day to try to complete that pre-cert with the provider. We know it's frustrating, and I think the best thing and the best advice is it's communication and letting your members know that we have to obtain the right clinical information so that we can use our guidelines and do a very thorough review and send cases to Dr. Connolly as necessary.
Cynthia, that's a really good point, and I would just like to comment on that from a practice standpoint. Excuse me, we have our own practice here in Chaska, Minnesota, and we work with insurance companies all of the time, and I'm very involved with how my staff deals with other insurance companies. And one of the things that I will say is when we get requests for records from insurance companies, oftentimes it's tough. It's tough to get those kicked around and turned around in the course of a busy day. If I'm asked specifically for something, it's hard to kind of carve out that time in the middle of your day to try to make sure that that gets taken care of. But one of the things Health Easy does really well, I've got patients who have all different kinds of insurance. Health Easy, with this team that you guys have in place, that we have in place, this is exactly what I need, this is what I'm looking for. You're not waiting in a phone line for 35 minutes to try to get information going back and forth. So Health Easy does a great job. There's other insurance companies that I've worked with that to try to get to their case management department is next to impossible. And so I think that that's one of the best things that Health Easy has done, is to give providers a really good point person to try to help with getting things taken care of and certified.
Great, thank you. Did any other closing comments? And we're pretty much up against the clock with the end of our webinar.
Jeannie, I just have a couple of things to say. And thank you so much. I think that this has been a great webinar, and I know that our focus today is on utilization management and case management. And the takeaway, I think, for the audience is that to know that Health Easy's programs, and yes, it's utilization management, case management today, but there are so many other different types of programs that your employers can have and maybe be interested in. Yeah, certainly being URAC accredited for both utilization review and case management, but also disease management. But also we are offering a full array of different types of services, like we were just talking about the telehealth type of programs. So there's different things that I'm sure, we can help. It's just really a quick conversation with your broker or your consultant or with your employers to get a better understanding of the full array and offerings that Health Easy has for employer groups. And, like we always say, this is not just all about denials and non-certs, right? Because that's a very negative connotation. You got to keep in mind, I think, that what we're really looking to focus here on is quality of care, right? And it's the member experience. With our 24/7 helpline, members can call us at any time, 24/7, which is phenomenal. I don't know of really any other TPA in the market that does that. So I think, that's really important to know.
Thank you, Cindy.
And then I'll be quiet.
We are out of time. Thank you, Dr. Conley. Thank you, Tammy, Danielle. This was fabulous. I hope we demystified some of the processes around this. I want to thank our sponsors for the 2021 Easy Webinar Series, Accurus Solutions and Nationwide Insurance. Thank you very much. Our next webinar will be on June 23rd, and you will hear from Dr. O'Neill, our orthopedic medical director, as well as Justina Lehman-Lane, and they will be talking about bundled pricing and value-based care. So look for that invitation coming out very soon. Thank you again.
Thank you.
Thank you all. And that concludes today's presentation. On behalf of the presenters and Health Easy, thank you all for joining.